Good afternoon. My name is Dr. Erica Kaye. I am a pediatrician, oncologist, and hospice and palliative medicine physician who cares for children with serious illness in Tennessee. On August 16th, Tennessee Governor Bill Lee signed an executive order to prevent local school leadership from implementing universal masking, blocking educators from using proven public health mitigation strategies to curb the spread of this deadly pandemic. In response to this executive order, I wrote an open letter to the governor on behalf of Tennessee healthcare professionals, strongly opposing the order. I invited Tennessee physicians and healthcare workers to join me in signing the open letter. Since that time, 3 days ago, more than 5,400 healthcare workers in Tennessee have signed the letter. Over the past 18 months, we have been battling a deadly COVID-19 pandemic that has killed more than 620,000 Americans. Healthcare professionals have done everything in our power to protect the public and provide care to the best of our abilities. The situation in Tennessee right now is critical. Tennessee ranks among the states most at risk for severe infection and spread of the virus. Many intensive care units across the state are already at capacity, yet we remain weeks away from the projected peak surge. Today, we as a united group of Tennessee physicians and healthcare professionals are delivering our open letter to Governor Lee on behalf of the more than 5,400 medical professionals who urge the governor to respect the physicians, researchers, and healthcare experts who recommend universal masking in schools to protect children, families, and communities. I would like now to begin reading the letter with the help of a few of the colleagues who have joined us today. Physicians, advanced practice providers, nurses, and healthcare professionals across the state of Tennessee stand in solidarity with our colleagues in Florida, South Carolina, North Carolina, and Texas, who have petitioned their state governments to remove mandates that restrict appropriate and necessary public health safety measures.
Dr. Kaye, there you go.
Over the past 18 months, we have been battling a deadly COVID-19 pandemic that has killed more than 620,000 Americans. We have done everything in our power to protect the public and provide care to the best of our abilities.
Hi, I'm Dr. Sara Cross. I'm an infectious diseases physician and also a member of the governor's coronavirus task force. Unfortunately, the Delta variant is currently surging in our state, straining our healthcare system beyond its capacity. As of August 13th, 2021, fewer than 4 out of 10 people in the state of Tennessee are fully vaccinated against COVID-19. The positivity rate in Tennessee is greater than 17%. Health officials have stated that positivity rates less than 5% are needed to slow the spread of the Delta variant. Unfortunately, our positivity rate is on a rising trajectory. Over the past week, we have seen an average of more than 3,000 new cases of COVID-19 diagnosed daily, with numbers rising steeply. More than 2,000 patients are currently hospitalized in Tennessee with serious COVID-19 illness, with positive net hospitalizations continuing to rise each day. Many intensive care units across the state are already at capacity, yet we remain weeks away from our projected peak surge.
Hello, my name is Dr. Sepehri-Harvey. I'm a primary care physician, board certified in family medicine, and I hold a degree in Masters of Public Health. Despite this grim data, on August 16, Tennessee Governor Bill Lee signed an executive order preventing local school leadership from implementing universal masking, effectively blocking educators from using proven public health mitigation strategies to curb the spread of this deadly pandemic. To justify this executive order, Governor Lee stated, quote, "Our hospitals are struggling under the weight of COVID, but those hospital beds are filled with adults. Requiring parents to make their children wear masks is to solve an adult problem. To solve an adult problem is, in my view, the wrong approach." As trained healthcare providers, we strongly oppose Governor Lee's executive order. Scientific evidence demonstrates that masks can decrease the spread of COVID-19. Scientific evidence demonstrates that children can be infected with COVID-19 and that children can spread the infections to adults. When community members, both adults and children, wear masks in the context of group setting, this action has the potential to decrease community spread of COVID-19. Decreasing this spread of COVID-19 allows us to flatten the curve, enabling our healthcare system to provide higher quality of care to sick adults and children alike.
I'm Dr. Joyce Williams, a critical care physician. We know that children under 12 years old remain vulnerable to the Delta variant because they are ineligible for vaccination. The Delta variant is significantly more contagious than the original COVID-19 virus, resulting in more children becoming infected. Although only a small percentage of infected children may become seriously ill from acute COVID-19 infection or multisystem inflammatory syndrome in children, as higher numbers of children become exposed to COVID-19 in our communities, we will necessarily see more cases of children hospitalized with critical illness.
Hi, I'm Dr. Katie Barger. I practice general pediatrics in an inner city, low income area. The American Academy of Pediatrics and the Children's Hospital Association are collaborating to share all publicly available data on pediatric COVID-19 cases. In the early summer, COVID-19 cases in children were decreasing. Unfortunately, with the advent of the Delta variant, cases in children have been steadily rising since July. Since the pandemic began, children represented about 14% of total cumulative cases. For the week ending on August 12, 2021, children comprised about 18% of reported weekly COVID-19 cases, a significant increase. In the last week alone, more than 120,000 new COVID-19 cases were diagnosed in children, and the numbers are continuing to rise. According to data from the U.S. Department of Health and Human Services, as of August 14, 2021, the number of children hospitalized with serious COVID-19 infection in the U.S. reached a record high at nearly 2,000. Children currently comprise about 2.4% of all hospitalized COVID-19 patients, and these numbers are rising at an alarming rate that is outpacing the capacity of pediatric hospitals to provide care, requiring hospitals to divert critically ill children to out-of-state hospitals to find an available bed.
I'm Dr. Dana Giel, a pediatric urologist. For these reasons, i.e., 1, to decrease spread of infection within communities, 2, to flatten the curve to enable hospitals to provide adequate patient care, and 3, to protect the health of children, the nation's leading pediatricians and public health experts strongly urge that all individuals in schools wear masks. There is no more reputable, esteemed national governing body for the health and safety of children in the U.S. than the American Academy of Pediatrics. The AAP is a nonpartisan entity comprised of the nation's top physicians and scientists with expertise in public health, pediatric health, and well-being. The AAP has unequivocally stated that all children, teachers, and school staff should be masked in schools during the upcoming year. The CDC also aligns fully with the recommendations of the AAP, strongly recommending universal masking for all teachers, staff, students, and visitors in schools, regardless of vaccination status, age, or local rates of community transmission of the virus.
My name is Dr. Seth Karol. I'm a pediatric oncologist. As healthcare professionals, we emphasize that no data exists to suggest that wearing masks causes physical harm to children. Claims about risks from CO2 exposure have been repeatedly debunked as untrue. Masks are an imperfect barrier to COVID-19, but they have been conclusively shown to decrease spread. This is crucial in the context of the Delta variant, which is much more contagious than the original strain. During the past year, flu rates were down 98%, with only 1/50th of the normal rate of flu hospitalizations, despite fewer flu vaccinations being administered. And this is entirely due to masking and social distancing. Masks are not convenient and they are not perfect, but they absolutely work to decrease viral spread and they do not cause harm.
My name is Dr. Rebecca Bittenbinder. I am a general surgeon and a lifelong Tennessean and a graduate of the University of Tennessee Health Science Center. A few months ago, the US was averaging approximately 10,000 new cases of COVID-19 per day. With the current Delta variant, we're on track to hit 200,000 new cases per day in the coming months. The implications of this 20-fold increase in daily cases are sobering. The more people who get infected, the higher odds are that the virus will spread widely and have opportunity to mutate into another more contagious and deadlier variant.
Good afternoon. My name is Dr. Jeremie Estepp, and I'm a pediatric hematologist who cares for children with catastrophic illnesses here in Tennessee. Every person has the ability and the responsibility to try to curb the spread of COVID-19 to prevent the development of new, worse strains of the virus. We understand and empathize with the desire to not backtrack. Wearing masks is not backtracking. It is the practical, necessary response to an acute, critical situation. And it's our best chance at decreasing the spread of infection, protecting the health and safety of children and community members, and keeping our schools open. We ask for your courageous leadership as we navigate this season of an evolving pandemic that continues to rage, both globally and at our front door. We ask you to respect the scientists and researchers and physicians in the American Academy of Pediatrics and within the Centers for Disease Control, who have recommended universal masking in schools to protect our children, families, and communities in the context of an ongoing deadly pandemic.
Data strongly suggest that without requiring masks, it will be difficult for schools to remain open as the Delta variant surges across our region. In his statement, Governor Lee said, "While we deal with this issue, it remains important that we keep our schools open and in person, as we've seen the devastating loss of progress our kids have had academically when schools were remote or closed." We agree with Governor Lee that we must do everything possible to try to keep schools open. Without access to vaccines, the only available protections for school-aged children are masking and social distancing. Recent models designed by researchers in North Carolina demonstrated that in an elementary school setting that doesn't require masks, 75% of students are likely to be infected with COVID-19 within 2 months. We must heed lessons from neighboring states like Arkansas, which blocked universal masking, and within days of schools opening, were forced to shut down an entire school district due to a massive COVID-19 outbreak, resulting in more than 800 people in quarantine. We urge Governor Lee and our elected leaders to listen to the healthcare professionals of Tennessee. An executive order that allows parents to opt out of masks threatens the public health of entire communities and our state at large. Please allow our local health departments to guide school boards in implementing universal masking when local spread is high. Please trust our expert recommendations as we strive to protect the health and well-being of the people of Tennessee. That concludes the text of the letter signed by more than 5,400 Tennessee medical professionals. And today we officially deliver this letter to Governor Lee. Thank you to everyone who took the time to be here today, and to those who could not be with us today, who took the time to make their voices heard by signing this letter. Governor Lee, on Monday, you were asked, who's advising you regarding COVID-19? You declined to name any physicians. We are here, more than 5,400 physicians and health professionals and experts. We urge you to listen to our counsel. An executive order that allows parents to opt out of masks threatens the public health of entire communities and the state of Tennessee. Please allow our local health departments to guide school boards in implementing universal masking. Please trust our expert recommendations as we work together to protect the health and well-being of the people of Tennessee. Thank you so much, and we have time for a few questions. If you have a question, please use the raise hand function and we will unmute your mic. Alternatively, you can ask your question in the Q&A box.
Okay, it looks like our first question is from Brett Kelman. Brett, you should be unmuted.
Can everyone hear me?
We've got you.
Great. First of all, thank you everyone for your participation in this. I have two questions, both for Dr. Kaye. First, I would like to ask, when you wrote that letter earlier this week, did you expect the type of response that you got? And does it surprise you that you're now on this call with about 90 of your colleagues doing what you're doing now? And secondly, this is not the first one of these calls that I have been on, and I imagine it's not the first one of the calls that many of the people who are on here now have been on. What happens if it doesn't work? If you get crickets from the governor, as has happened before, what's next?
Thank you for those questions. They are very thoughtful and excellent. So to address the first question, throughout the entirety of this pandemic, my interdisciplinary healthcare colleagues have offered sage advice and solidarity and encouraged evidence-based approaches to improving the health and safety of everyone across our communities. And when Governor Lee signed this executive order, many of our frontline healthcare workers expressed to me and to each other feelings of profound demoralization and worry and fear about the potential ramifications of this executive order on the health and safety of our children and communities. And so I wrote this letter, the Tennessee healthcare professionals' response to this executive order, simply to provide a mechanism to elevate the voices of so many frustrated and frightened healthcare professionals across our state. I was not surprised to see the response to the letter. I think many people felt some degree of feeling seen and validated, and to that extent, a catharsis from having the ability to be empowered to sign this letter. And we stand today as 100 physicians and healthcare experts representing 5,000 and more, because signatures continue to grow on this letter, representing a medical community that is pleading with our state leadership to listen to our expertise to save lives. To address your second question, our hope is that our leadership wants knowledge and information. I also wrote this letter because I believe we all have a responsibility to promote the sharing of accurate information, and healthcare professionals in particular want to spread correct information and recognize that this executive order fails to acknowledge existing data and ignores evidence-based recommendations from national, statewide, and local experts. And so we are hoping to combat misinformation and to share that expertise to empower our leadership to evolve with the current data and make different choices to help better protect the constituents of our state. If our leadership does not respond in the way that we hope to this letter, we also hope that seeing this significant standing of solidarity of medical experts across the entire state of Tennessee will empower our local school districts to do everything they can to continue to protect children and community members, and to come together and trust healthcare experts as we navigate the coming weeks.
Thank you very much, Dr. Kaye. I have an additional question since I'm still unmuted. Dr. Cross, if I remember correctly, you were or maybe still are a member of the governor's COVID-19 task force. I was curious if you could clarify for us if you're still on that task force, if that task force still exists, and what that experience has been like.
Task force was formed in March of 2020. We probably had about 5 meetings total. The last meeting we had, I believe, was in July of 2020. Meetings consisted of conference calls. Usually a task force is formed of people of different backgrounds to come together and develop ideas and solve problems, and that's not what this task force was. We never were asked for our advice, our expertise, and we never gave any type of recommendations to the governor, to our leaders about this pandemic. As far as I know, I'm still on the task force, but probably not for much longer. And I haven't heard a word since July of 2020.
Thank you. All right, our next question is from Blake Farmer. Blake, you should be unmuted.
Great, and I was just hoping that we could hear from one of our pediatricians or maybe a nurse who is working directly with pediatric patients in the hospital. I know that's been, obviously the numbers are not gigantic, and yet I think there's been a little bit of just thought that this wasn't a big deal for kids. So can anybody who's been working in a pediatric unit, ICU, sort of talk about what they're seeing and how things are changing by the day?
Can you hear me? This is Shelley Ost.
We can hear you. Thank you.
Hey, this is Shelley Ost. I have not been on the COVID service, but I do inpatient at Le Bonheur. And I was recently on the first half of August on the non-COVID service. And I've done the COVID service 2 or 3 times before for 2 weeks at a time. And I can tell you the Delta variant is very different. Previously, I would have every COVID patient in the hospital at Le Bonheur that wasn't in the ICU. And I don't even think there were even necessarily in the ICU. And I would have maybe 2 at a time. Currently, they have had to expand past the COVID wing, which is 16 through 24, like roughly 8 or 9 beds, allow those patients to go on different floors of the hospital in negative pressure rooms. There have been several in the ICU, some on ECMO. If you don't know what that is, that's extracorporeal membrane oxygenation. It's basically a heart-lung bypass for when someone's lungs are so severely ill, they're not doing the work of oxygenating the body. Most recently, this past weekend, the pediatric intensive care unit is so full that a patient who had COVID, who was on the COVID regular floor, coded, so either had a respiratory or cardiac arrest. I don't know the exact details. And that patient actually had to wait until they could move another pediatric patient out of the pediatric intensive care unit to put that patient who had just suffered a respiratory or cardiac arrest into the pediatric intensive care unit. The ER is beyond overrun, and I think Dr. Sarah Green is on and she can speak more to the emergency room. The hospital was already full with RSV, and now the COVID on top of it is much, much worse than any time in the past. And we know that as numbers go up, the hospitalizations and severe illness delays And so as the cases go up, we only know this is going to multiply, and it's going to be, there's already nowhere for these patients to go because there's just not capacity.
Thank you. Would Dr. Green like to chime in, or is she available? Would any of the other
Thank you,
physicians
Dr.
like to
Ost.
chime in? Okay. If anybody else would like to chime in, go ahead. Otherwise, we do have another question from Holly McCall, wanting to know which physicians from East Tennessee Children's Hospitals, if anybody was on the line there. I do know that there were probably 20 plus Chattanooga area who have a letter, and many others from East Tennessee, a part of the letter. I'm not sure who all is available on the call right now, but would any physicians in East Tennessee like to chime in? Feel free to go ahead.
I'm not from East Tennessee. This is Dr. Diana Sepehri-Harvey, but I did want to circle back with Blake Farmer's question. I'm a family medicine physician, so I see pediatrics and adults as an outpatient. And I want to just bring to everyone's attention that not only our hospitals are seeing a lot of COVID patients and it's adversely affecting their health in a severe way, but also in the community, so many families every day. Just this morning, I had 3 families whose kids are sick with COVID, and the family, the mom or the dad now are out of work. They're at home with their kids because 2 days after starting school, 1 week after starting school, they have tested positive. The whole family is in quarantine. It's a loss of work for family, loss of school days for the children. Most of schools are not able to pivot to a virtual platform right now. So it's loss of learning. So this is very much impacting our entire community, not just the ones who are hospitalized, but that community at large. We're finding people not being able to work and not being able to go to school because of these outbreaks.
I also see Dr. Washington with her hand raised. You can unmute yourself.
Hi, good afternoon. Dr. LaTonya Washington. I am board certified in internal medicine and pediatrics, and I also sit on the Memphis and Shelby County COVID task force. I did want to just echo and comment that this morning on the task force call, the information that is released is that they continue to see a steep rise in the number of COVID cases in children. And from my understanding, Le Bonheur has the highest census of COVID inpatients that it has ever had. And from my understanding, there are 5 of those children who are in the pediatric ICU. And I believe they commented that 2 of those patients were on the ventilator. I do also believe that there have been pediatric deaths at Le Bonheur associated with COVID-19. So that's the comment that I wanted to make. Again, that was what was reported on the Memphis and Shelby County COVID task force call this morning. Thank you.
Thank you. All right, doctors, I'm not seeing any other questions. So if you'd like to close it, we can go ahead and conclude.
I see just in the chat quickly, there's a physician in Kingsport, Tennessee, who would like to make a comment in response to the last question. Go ahead and unmute yourself.
All right.
Sorry, it took me a second to unmute. I'm actually an outpatient pediatrics in Kingsport, Tennessee, and previously was in the ER with our hospital system. I did speak to some other general pediatricians this morning because we are very concerned. The last I had heard, we had 2, we have a small pediatric ICU, and there were 2 beds available still, and 3 patients with COVID, and the rest were another mixture of upper respiratory infections. But one of the physicians called for an admission and was told that they didn't have any beds for a neonate with hyperbilirubinemia, and that they could send the infant to the ER and it could be boarded in the ER. So our situation is changing and every day it's difficult. Some of the other pediatricians who are seeing outpatient practice are seeing somewhere of 40 to 50 patients a day. And it's very, very busy. My practice is a little bit different. And I do house calls, and I don't usually see more than 6 or 8 patients a day. And I was hitting 11 and 12 and staying up until 2 and 3 in the morning. So we are definitely feeling it.
Thank you.
I'll also say Dr. Sarah Green is currently working in the emergency department. She was hoping to join, but sent a message that she is slammed and they have so many patients that she's having difficulty being able to pause to join the call. But she has been vocal and expressing that she's deeply worried, and that that if you bring your child to the emergency room, you can expect to wait 12 to 16 or more hours in the emergency room to be seen, because the volume is outpacing their capacity.
All right, thank you, Doctor. I'm not seeing any other questions, so I believe it's yours to close.
Okay, well, thank you so much to everyone for joining this letter delivery and press conference today. We will be sending a press release and the recording shortly, and we hope that everyone is able to stay safe. Thank you again for joining, and have a good afternoon.